cost of Obamacare. Good evening and thank you for joining us at 5:30. I'm Kurt Ludlow.
I'm Tracy Townsend. For the first time tonight, we're getting a better idea of exactly what the health exchange means for your budget. These are numbers just released from the Department of Health and Human Services. Here's how the federal health plans break down. For a 27-year-old living in Columbus, you could pay as little as $196 a month, but some plans will cost closer to $250.
And we also found information for a family of 4. Before a tax credit, a plan could cost you $751, but if you get that credit, your family could pay $273 a month. Tonight, many employees are asking whether their employer is likely to keep providing health insurance. And 10 TV's Jim Heath joins us here with what he's found. Jim?
Yeah, Kurt, there's no easy answer to those questions this evening because absolutely no one knows for sure how these costs are going to shake out in the long run. What we do know tonight is that some small businesses may decide against providing health insurance and instead tell their employees to check out the new exchange, which begins on Tuesday.
Walgreens announces its 160,000 workers must buy health insurance through a private exchange. Home Depot has eliminated health insurance benefits for 20,000 part-time workers starting October 1st when the exchange begins.
They may be required to offer something that they may not have had to offer before, and that's going to be a new cost in their business that they're trying to figure out how to manage.
Steve Milliard from the Council of Smaller Enterprises says it's not just Home Depot and Walgreens. He says confusion about coming changes in the health care law are leading many businesses to take action.
What you're starting to see is employers getting a little bit more strict about who gets access. So you've seen major employers begin to eliminate spouse coverage or trail back coverage for pensioners and retirees.
Milliard says there are benefits to both employers and employees when the new marketplace goes into effect. Employees can review and determine what's the best insurance option for them. Businesses can take advantage of federal tax credits. And there will be a variety of plans offered for both employees and businesses. Some hospitals are cutting back too. The Cleveland Clinic says it's drastically trimming its budget to prepare for rising health costs.
And I guess I would dispute that it's Obamacare or the Affordable Care Act.
Kathleen Geminder from Ohio Consumers for Health Coverage says rising health costs is not a new issue.
Employers, those who pay the bills ultimately are saying, hey, we've got to find a less expensive way to do this.
A Rand Corporation report estimates that businesses with less than 100 workers will pay almost 6% less on premiums in 2016. But just about everybody agrees tonight that the exact effect on businesses, large and small, is very hard to predict because there are still so many factors at play. For more information, by the way, you can log on to our website, 10tv.com.